Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back to the Antibiotic Crisis, the role of antibiotic stewardship. In our first episode, Understanding Antibiotic Stewardship, Dr. Patrick Welch and I discussed the basics of antibiotic stewardship, its importance in healthcare, and that critical role that we as healthcare providers play. In this second episode, we're going to look closer at practical strategies and best practices that can be used to promote antibiotic stewardship in all clinical settings. And our goal is really to equip you with actionable insights and tools to be able to effectively contribute to antibiotic stewardship and improve patient outcomes. Dr. Patrick Welch is back with us to walk through these strategies. Patrick, thank you for sticking around to continue this discussion.
Yeah, no problem. Thank you for, again, I think this is a very important topic, so still lots to cover.
Absolutely. Well, let's start with, I know we talked a little bit about your residency and having to talk to, surgeons about their cultural practices, we'll say. So do you have some effective communication strategies that can really help with not just educating patients, but your interdisciplinary team as well?
Yeah, again, a lot of it comes down to the education and understanding the why behind it, right? So
Right.
if we can develop within our system or our clinic, the culture of understanding the why behind why we're asking certain things, why we're making recommendations, or why we're, always bringing up a stake about antibiotics, that can just setting the base there is huge. Is back to my residency is I was on that infectious disease rotation. Our pharmacist was fantastic, and some of the clinicians, they'd see us walking down the hall and be like, "Oh no, now what am I going to get yelled at?" So I think from those that are making those recommendations, or from a pharmacist standpoint, if we're going to ask questions or point out, hey, this might be an option we can make a change to, just having that understanding of first asking, hey, tell me what you're treating and why we went with this choice, right? Get that baseline understanding instead of walking in and saying, hey, Ancef was a terrible choice. Let's switch it over. And that will just that can help develop that confidence from the team, as well as that collaborative environment where there's trusting relationships going back and forth. And so that communication strategy of making sure we understand we're all on the same team, our goal is to improve the patient outcomes, as well as reduce our antibiotic use and making sure it's appropriate. That's key to making sure the communication lines stay open amongst the team.
Absolutely. And I think just recognizing the roles that we play and the knowledge that we have. We can't all know every single thing there is to know, which is why you're an expert in medications. And, they might be an expert in taking care of the patient in whatever area that they decided to, specialize in.
Absolutely.
But just recognizing everybody has a level of expertise and how we can all come together and use it together, which as I said in episode 1, I've really seen just by pulling you guys out of the dungeon, making you more, you're more out there where we can easily get to you and have those discussions and make decisions together for the better of the patients. So
yeah,
that's a
absolutely.
huge step forward.
Clear roles, like we see that in other settings, right? If there's a code, we know our roles, we know what we're doing. And so having those clear roles and expectations that really leverage the expertise is great. As we look through antibiotic stewardship programs, there's certain guidelines out there that kind of help determine roles and how each healthcare profession can have an impact in the program. And I think I'd like to just highlight a couple of those. I'll give a first example for nurses. So we talked a little bit about nurses in the first episode of triaging, getting adequate patient histories, making sure we understand true allergies and things like that. But our nurses, again, frontline there at the bedside, they know proper techniques when it comes to reducing contamination of cultures, making sure our cultures are correctly gathered. Urine cultures are a big one, right? Making sure we've got a clean catch there. So our nurses play a huge role in making sure we get the right data and that it's coming from a true source. They're also our nurses are very aware of when their patients can't tolerate things by mouth, right? NPO versus when they can. And so if they're on an IV antibiotic, by all means, our nurses should be speaking up during rounds or chatting with the pharmacist saying, hey, my patient's now eating, can we switch this IV antibiotic to oral? And so having that open line of communication and that respect amongst the team where anybody can bring up a concern. The other thing that I think nurses are in a great position to do is just speak up if an antibiotic's been on for a while, right? If it's been day 6, day 7, day 8, and they're still on an antibiotic, maybe we say, hey, what's our expectation? How long should we be on? You don't have to say, hey, normally this is 5 days. Just bring up the question of, hey, what's our goal with this antibiotic? And so those nurses,
so don't say, do y'all remember that they're on an antibiotic?
Yeah, right. Bring that up. Like that's our nurses are fantastic at that. And so again, and with the communication, making sure we have that collaboration on the team where we feel comfortable, hey, we can raise a concern or we can ask a question. It might not be my area of expertise, but I can ask that question to the expert on our team. And that'll give me more information that I need to say, yep, that's a great decision, or maybe let's pivot and come up with a different plan.
I want to just kind of piggyback on what you were saying about knowing your roles. And I think that in any relationship that you're in, it's all about how we communicate and our perception, right? That can affect any relationship. And so not only me knowing my role and you knowing your role, but I need to understand your role and those expectations, and you need to understand my role and my expectations so that we are able to be a good partnership within patient care.
Yeah, absolutely. And that's I think along with that is also recognizing when, hey, it's maybe out of our scope or we need a little more expertise, right? As we can round as a team, but we should make sure that we've got infectious disease on the side if we need them, right? They're the true experts in this. And so if there's a question on the team, we're not sure, I'm going to reach out to my ID pharmacist, right? Or our physician's probably going to reach out to the ID physician. And so just making sure we understand, all right, this is above my pay grade, if you will, right? We need to bring in the expert and making sure we all understand our roles, but also when we do need to reach out for that expert opinion.
Absolutely. So playing into infectious disease, what role does infection prevention and control play in antibiotic stewardship?
Yeah, so going back to the resistance portion and how the bacteria develops that resistance, we've talked about exposure to antibiotics, and if it's not the right drug treating the bug, that bacteria is going to develop those resistance mechanisms. Infection prevention is a huge part of that, right? If whatever bug I have starts to develop a resistance pattern or a mechanism, and then I go out, that bug's in my nose, I wipe my nose, shake somebody's hand, that bug I just transferred over to them, right? So the bacteria is developing resistance within me, and if I go to spread that, that means those around me are going to have a lot more likely chance of having that resistant bug. So making sure we're following proper isolation precautions, making sure, again, we're educating our patients on, hey, if you're sick, let's stay home. Let's wash our hands. Let's make sure we're doing those proper things so that we can prevent that spread of whatever resistant bacteria we have to others.
Well, to play on this, you see, since school's back in session, you see a lot of this in locker rooms, MRSA.
Yeah. Yep, absolutely. So I mean, my kids just started a couple weeks ago. I lost my voice last week, probably because of whatever they picked up at school. But
Uh-huh.
yeah, that's I and credit to, I don't know if it was my parents or just our education system. When I was in high school, I was a wrestler, and ringworm was common, right? And so
Yeah.
I knew, hey, as soon as I'm off that mat, I'm going to shower, I'm going to clean off because maybe I pick something up. I don't want to get that. Right.
Hmm.
And so again, that education to just the public on making sure we're proper hygiene, treating things, and making
Football
sure we're staying whole.
pads.
Yep. Yep.
Hmm.
And that sharing of things, right? Now with technology in classrooms, they're sharing earbuds, they're sharing everything. And so there's lots of touch points. Again, that proper hygiene is a big thing that we can push to help reduce the resistance that we see with bacteria.
I think that correct me if I'm wrong, or if you know, but speaking of things that we share and pass along in schools, but lice, it seems like lice has gotten harder to get rid of as well.
Yeah, that's a great example, because it is becoming harder and harder to treat. I know there can be different opinions on how school districts are
Hmm.
managing lice, or even if they're telling parents in that classroom that somebody might have been exposed. But yeah, that's a great example of some resistance developing where it's becoming harder and harder to treat that, and that again, we could tie that into any sort of antimicrobial resistance that's developing, and the importance of making sure we've got good stewardship so that we don't
Hmm.
see that develop with bacteria and more fungal infections as well.
So it seems like that an antibiotic stewardship program may be worth investing in school districts as well. So not just in the hospital setting or the clinic setting, but in a place where we know we share a lot of unfortunate
Yeah.
things.
Yeah, absolutely. And even in the health department, right? With your
Hmm.
city or town, in that health department setting, that's a great way to make an impact, whether you're going out and doing outreach to school districts, or things like that. But yeah, that's a fantastic idea and place again where we can have a little bit of impact, of just it's purely education mostly, right? In those
Hmm.
settings, but education that can definitely have an impact down the road.
Because most of that is going to play back into infection prevention and control.
Correct. Yep. Yep. Right. Let's make sure we don't share the comb, right? Let's keep our hats on our head and not let our
This is
friends
how
use
we
it.
clean pads. If
Yep.
you're going to share them, this is how we clean them.
Yep. Yep.
Um,
Exactly. Right. So just basic
mhm,
infection prevention techniques at that level.
absolutely. So, what type of data and metrics can be used to monitor and improve antibiotic use in practices?
Yeah, that's a great one. Again, we can look at prescribing habits now with electronic medical records. Data is always there. We can pull different
I
data,
want
but
to pause you on this because I have
yeah,
another question. Exactly what you're talking about. We can track the usage of how many are prescribed. Do you think that that's also going to have an opposite effect? And now I'm afraid to actually prescribe
yeah,
antibiotics, which could then also continue to harm?
yeah, right. Because if we're scared to
Mhm,
prescribe and there's a true
mhm.
infection, definitely can lead to harm and poor patient outcomes. Um, Again, I think I know I've harped on the education component of it,
Yeah.
but I think if we have good education to our healthcare teams, that hopefully I don't foresee that causing issues. If we look back at that study we talked about in the last episode, with Intermountain Health and
Mhm,
University of Utah, they did share that data amongst those providers. And so they could see, okay, this is how I compare. Oh, I'm really overdoing it. But even with that upfront data sharing, those outcomes were improved, right? Patient
mhm.
outcomes improved, number of antibiotics prescribed for unnecessary conditions improved. And so from what I've seen, I haven't had that concern yet of it's preventing treatment in those patients that absolutely and
Mhm.
necessarily. And as clinicians, our clinicians are very well educated. They've gone through that training of what a bacterial infection is and what it looks like and how people might present. And so that's a great concern, but I haven't seen it specifically. But I mean, nobody likes to be micromanaged. Nobody likes to have that specific oversight. And so I could definitely see that
start to doubt yourself a
cautionary
little bit.
creep in. Yeah, absolutely.
So when you're talking about the data from that particular study, how do they determine if, maybe this physician has a higher rate for prescribing for this month than the other one, but maybe he actually saw more who needed it? So how do they look at those metrics? How do they track that data?
Yeah, so I mean, we can tie it not just, who prescribed what medication, but we can look at the diagnosis code, right? The reason they were in for that visit and what the ultimate diagnosis was. I think one thing that's important to also pair with that or make sure we acknowledge as we're looking at the specific prescribing trends is what's going around in the community, right? What are we seeing in the community? And so let's track cultures or viral swabs that we're getting and let's see what's going around. Because there might be a couple months where, we've got higher ear infections for whatever reason, and we're seeing more and more ear infections, right? Or, if we look at on a flu side, maybe we're giving a lot of Tamiflu for patients because that flu's up. And so making sure we're not only looking at one specific data set, but taking the full picture, seeing what's going around. And again, comparing that not just from clinician to clinician in a specific setting, but the region or the area, and let's see how other clinics are, because I bet now most of the time you would see if we're seeing certain clinicians with higher prescribing during a specific time, the other areas are going to have probably similar prescribing patterns with that.
They didn't just look at one clinic, they looked across the entire system.
Correct. Yeah. And in fact, that study with Intermountain and University of Utah, they have, I don't know the number, but there is a lot of urgent care clinics within those system networks. And so there was a very large population that they looked at with that specifically. But yeah, with the stewardship program, again, making sure we're looking not just at individuals, but as the system itself. And if we see something that's concerning, I think it's important to point out that we should be targeting the system. We should be looking at the processes and see if that's what's contributing to it and not single out an individual, right? But give the education overall and then reevaluate our system, reevaluate our stewardship program and making sure that that's not what's pushing, these clinicians to prescribe one way or the other.
Now, when we're talking about using data and also educating our providers, do you see that that there are some maybe older versus younger who are kind of set in their ways and they're harder to get them to understand versus some who are like, oh yeah, no, I totally understand where this is going and I'm going to do my part to keep this from happening?
Yeah, I think so. And I think those that have been in a healthcare setting for a while have probably seen a little bit of evolution where now, and even in training, as different providers go through training, there's a lot more of a team approach, right? Even in school, there's a lot more focus on a team approach. And so that training has evolved where, our older or more seasoned colleagues didn't have that same collaborative team. A lot of times they were the ones doing everything. And so they didn't have the ability to reach out to infectious disease or didn't have the pharmacist on board, didn't have, a stewardship program. And so they have been accustomed to, hey, this is what I do. This is how I treat it. Whereas the up and coming healthcare professionals have gone through that training and have come to understand we deliver healthcare best when we're in a team setting and that collaborative setting. And I would say credit to those older healthcare providers that have been out in practice for a long time, because I've seen a lot evolve and they have been more than willing to say, hey, we've got a team. This is amazing. let's work as a team. So again, overcoming the cultural deficiencies that we might see in that setting, I think has definitely made substantial improvements where I don't have, in my practices, I haven't had a whole lot of concerns with that as again, most are open to having additional help and having that team approach.
Absolutely. What are some practical tips for really ensuring that we're adhering to the guidelines that are set for antibiotic stewardships? And there are already guidelines out there, right? Is it the CDC that has the stewardship guidelines?
Yeah, there are. So the CDC actually has a really good website to look at, and they base it off your location. So whether you're in an
Oh,
outpatient clinic, inpatient, if you're in the health department, they have resources for that as well. And they walk through basically step by step on, again, what is an antibiotic stewardship program? How can we set it up? And
hmm,
not just setting it up, but that reevaluation of your program. And so looking back, anything we do in the healthcare setting, again, we like to reevaluate, we like to
hmm.
debrief. As we all went through training, we remember running fake codes and having the
Yes.
debrief session after, right?
Hmm.
Let's think of antibiotic stewardship like that as well, where we always need to have a little bit of a step back. Let's reevaluate, the data gathering, each role, make sure that we're implementing those roles and have that step back and look at it. And as we look at the roles that we play in our program, again, having somebody that's the accountability expert for the
Hmm.
program is key. And again, it works best if it's multiple people on that or a committee, so that everyone's got some sort of accountability, that we're reassessing and reevaluating all the time because this changes, right? This topic
Hmm.
always changes. Our
It
bacteria are
does.
evolving, and so we need to make sure we are evolving with it.
Absolutely. What are some stewardship policies and practices that are important to have within the organization to be successful?
Yeah, I think, again, I think recognizing that everybody's going to have a role in it. And so the policy should specifically call out roles, right?
Hmm.
I think I've got a fairly good example, within the system that I work in. We have in our emergency departments, we have a UTI callback from our
Hmm.
pharmacist. So patients come in, have a UTI, we get the culture, they're sent home right then with some sort of antibiotic. And our pharmacists, once that culture comes back, our pharmacists have a collaborative practice agreement where they will look at the culture. If the bacteria doesn't match the antibiotic that was given, they're going to call that patient and they're going to make the change. They don't have to go and get the okay from the provider, right? We already have a diagnosis, we've got the bug, we know the source, and so the pharmacist can make the appropriate change on that antibiotic. And so as we look at those policies, making sure that we have policies that allow each expert on that team to work to the full scope of their license, right? Making sure we're not handcuffing them and saying, well, you have to do this and this. And then again, the policy shouldn't be anything that people are concerned about. Right. I don't want our provider to not prescribe the antibiotic because they're worried about backlash that they might get. And so making sure that
Hmm.
policy again is focused on the system itself or the processes and not penalizing an individual for that. And really that's I think what leads to more collaboration in the team. Nobody's scared to speak up. Nobody's scared to make a wrong decision, because they know it's going to be evaluated, but there will be education and it's going to be more of a system approach instead of trying to call out a single individual.
I think that's really important too, is to feel that your team has your back, but to also be aware that we do make mistakes. We might interpret something incorrectly, um, you know, but to learn from it, to learn from
Yeah,
our
absolutely.
mistakes.
Absolutely.
Yes.
And that's interpreting things incorrectly. We've all seen it. I've done it. Those on my team have done it where we see a culture, we quickly glance at it and think, hey, this is the right decision. And it takes again somebody on our team to speak up and say, hold on, let's look at that
I
culture
don't think
again,
that
right?
was
Like,
what you thought it
what were you
was.
thinking, Patrick? That's yeah, right. Let's remember where that source came from and what we're treating with that. So again, just that ability to have that collaboration on the team and the comfort level of being able to speak out is key.
It's interesting that you're talking about, or we're just talking about mistakes. But when I think of antibiotic resistance as a whole, I think all of that is learning from our past mistakes. We are now dealing with the lack of understanding that we had when antibiotics came about. So now we are having to backtrack to deal with the mistakes that we made in the beginning when we first had antibiotics.
Yeah, absolutely, right, and that's
Hmm.
the key going forward, is that's what we're trying to prevent, is more of these bugs, more of these resistant bacteria, and changing that. And change is always hard. We see
Hmm.
change all day, every day in the healthcare setting, but really making sure we can focus on it now is gonna pay dividends down the road, to really prevent further poor patient outcomes because of resistant bacteria.
Are we seeing antibiotic stewardship programs opening up in things like agriculture, not just in healthcare?
Yeah, so we talked about the CDC's
Hmm.
website and guidance there. They also have a portion of that website kind of dedicated to agriculture, dedicated to, again, we talked a little bit on the veterinary side of
Hmm.
things, and things like that. So again, it's a whole community effort for antibiotic stewardship, not just in the healthcare setting, but our farmers, those working in the agricultural setting, those dealing with livestock, as well. So it's a whole community effort to really make sure we're utilizing those antibiotics only when necessary, to prevent that further resistance.
Are you seeing any new horizons of antibiotic development, or even newer antibiotic resistance that maybe isn't being talked about as much yet?
Yeah, so there are new antibiotics in the pipeline. The first episode we talked a little bit about how we've had a long period of time without really any novel mechanisms for antibiotics.
Yeah.
And again, a lot of that is there might not be a whole lot of incentive from a financial standpoint to those that are developing medications, but over the last couple of years, there's been a little bit of a pickup in that, where we're seeing a little bit more and more come out. um, Again, one of the hard things can be, hey, we've got an infection, we know how to treat it, but is it ethical to give somebody an antibiotic that might not treat it, right? So that can be
Hmm.
a barrier to some of that new medication development as well. But I would say, as these newer medications come out, I think it's key to make sure, if we're considering using a new antibiotic that comes out, making sure we're involving our infectious disease team, because again, we don't want to get a new antibiotic that we think, great, this is fantastic, let's
Yeah.
start using it. And we're in that same cycle of, great, now we're creating more resistance to this. And so, again, as new medications come out, new antibiotics come out, which there's more in the pipeline. It's important to make sure we don't get excited and overuse
Hmm.
that from the start, and making sure we're
Right.
involving those experts on whether or not that therapy is appropriate.
Absolutely. Do you have any resources that and training opportunities that you might want to highlight?
Yeah. So again, I know I've spoken about the CDC. They
Hmm.
have great resources regardless of your practice setting. If you go to their website, if you just do CDC antibiotic stewardship, that'll pull up a whole bunch of resources and training modules. They also have some good patient handouts. And so we've talked about patient education and making sure we can get that education out to patients. They have some good patient handouts there as well that are easy to read, and you can quickly hand out to patients. Another one I'd recommend is just the IDSA stewardship page. So Infectious Disease Society of America. They also have some really good resources on antibiotic stewardship. Obviously, they're usually our kind of gold standard guidelines that we're looking at, in this realm, and so they have some really good resources to go to as well. But there's plenty of resources out there. I'd start with the CDC website, click on your specific practice site setting, and go
Hmm.
from there, as it's a very comprehensive overview.
It's really good to know. So, some really great resources there. So, Patrick, before our time ends, I want to try to wrap up some of what I kind of took away as some key takeaways from looking at this. But first, we know that if we don't continue to do something, this is not just a USH threat; this is a global health threat. So, there really is an urgent need for effective antibiotic stewardship that we could really see devastating consequences as early as 2025 economically and with loss of life if we really don't heed these warnings and become effective stewards of the resources, including the new ones that we have in our pipeline, because we don't want to repeat this again. The others that I took away is that, nurses, even nurses, we really do have a vital role in antibiotic stewardship, from, just even like you said, monitoring antibiotic use to educating our patients on what really is an allergy and when do you really need an antibiotic, but also helping to implement infection control measures and holding people accountable in these infection control measures. Because not only do we need to reduce and preferably halt inappropriate antibiotic use, but we need to also prevent the spread of resistant bacteria. And then lastly, if your hospital or clinic does not already have an antibiotic stewardship program in place, this is a really great initiative. We've seen the data that has really proven that can substantially reduce antibiotic misuse. So is there anything else you want to emphasize before we end?
Yeah, no, I would just say that last point, if you don't have a current stewardship program, just speak up, right? Ask leadership, ask somebody, speak up, bring that to the attention, and that's going to start getting that ball rolling. And if you don't know where to start, again, go to that CDC website. They have a good plan to kind of get things up and rolling.
Yes, that's a really great resource. Thank you so much, Patrick, for making time for this discussion today.
Yeah, thank you.
So to our listeners, thank you for taking time to listen to our discussion and equip yourself with the knowledge needed to provide amazing care to your patients. I also encourage you to explore many of the courses that we have available on elitelearning.com to help you continue to grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.